Okay, so this week's topic is a liver transplant. All right, so a liver transplant is the replacement of a diseased liver with that of a healthy one from another person. Whether that person is deceased, usually it's a trauma victim, or you can get the lobe of somebody else's liver that is still alive. However, that is not as common. It's a treatment option for end-stage liver disease or acute liver failure, which is caused by a multitude of issues. Most commonly, however, many times it's caused by hepatitis or long-term alcohol consumption. Okay, so number of livers are obviously limited. Not everyone with a malfunctioning liver is qualified to be a candidate for the surgery. To be a qualified candidate, one must have a strong chance of surviving the procedure and any potential complications, which would include not having any metastasized cancers anywhere besides the liver. They also must have proven that they can reliably take medications. They also must have proven that they are compliant with care, obviously, because they do have to take a lifelong medication regimen to prevent rejection of the new liver, which we'll go over in a few minutes. A patient must also not be currently engaging in any behavior that is known to be damaging to the liver, which is such as drinking alcohol or partaking in the use of recreational drugs. All right, so the nursing process for patients with a recent liver transplant. All right, so for your assessment, when you have a patient who's recently just had a liver transplant, you're going to assess for the signs and symptoms, first and foremost, of rejection. These signs would include tachycardia, fever, upper right quadrant pain, and then change in the bile or increased color or increased jaundice. And then also you're going to see increased ALT and AST levels. All right, so for a diagnosis, the one main diagnosis we're going to have is risk of infection related to the surgical procedure. And for our goal for this patient, our goal is going to be that patient will remain free of complications related to their liver transplant throughout the course of their treatment, which is, pretty much lifelong with all of these patients, because they're going to be taking anti-rejection medications for the life of their transplant. So some nursing interventions for these patients: you're going to administer your immunosuppressants and then your antibiotics as ordered. You're going to drain the T-tube in a dependent position and empty frequently, documenting the amount and description of drainage. You're going to monitor their vital signs and neurological status, and then you're going to closely monitor any surgical dressings for purulent drainage. So the big one for this one is going to be patient education, given that managing the procedure. So first and foremost, you're going to encourage your clients all to abstain from alcohol and engaging in an alcohol recovery program if still necessary. This is because in doing so, it'll prevent further scarring and fibrosis of the liver and will actually allow, the new liver to regenerate and become as functioning to the best of its ability. You also want to inform the patient the importance of consulting with their healthcare provider when taking anything over the counter that's new to them that hasn't been already discussed. That is inclusive of herbal supplements as well. You also want to inform the patient of the importance of taking their anti-rejection medications, and also having their white cell blood count monitored. You're also going to want to educate the patient on the signs and symptoms of rejection that we had just gone over in the assessment process. So yeah, that's pretty much just the nursing process for patients with a liver transplant. Additionally, I did want to speak about medications. All right, so 2 big medications for patients with liver transplant, 2 classes would be anti-rejection medications and anti-infectives. So an anti-rejection medication is also known as an immunosuppressive medication. These drugs weaken the immune system, but they do not eliminate the immune system completely. Immediately following the transplant, you'll take these medications in high doses, and then over time, different combinations and smaller doses will be used to develop balance between reducing the immune system to avoid rejection, but also minimizing the side effects. So in the beginning, these patients are actually going to be very immunocompromised, so you got to watch out for that. And then, so the anti-rejection medications, they're going to be taken for the life of the liver transplant, if I had not previously mentioned that. And then anti-infectives, so you're going to be taking those, the patient's going to be taking those for 1 to 3 months after the transplant, and that's because they have a high risk of infection because of the decreased immune system from your anti-rejection medications. So that's pretty much just going to protect the patient from certain bacterial, fungal, and viral infections. However, but not all. So it is still very important to monitor the patient for signs, symptoms of infection. And then otherwise, the physician will usually prescribe medications for the patient to help manage some of the side effects of the anti-rejection and anti-infective medications. All right, so that is pretty much just a quick overview of nursing care for patients with a liver transplant. And thank you for watching.